You could be in the best shape of your life right now, running 5 miles a day, eating clean, sleeping 8 hours, and still have something growing inside your chest that could kill you without a single warning. No chest pain, no shortness of breath, no dramatic warning signs that something is wrong. Just a normal Tuesday morning, and then nothing. That is not a scare tactic. That is the biological reality millions of people are living without knowing it. The most dangerous heart condition on the planet does not announce itself. It builds quietly, patiently, and invisibly, right up until the very moment it decides to stop your heart cold. Here is the part that should make every single person stop scrolling. For half of all men, the very first symptom of heart disease is not discomfort. It is not a tightening in the chest during a jog. It is sudden death, no second chances, no ambulance ride with a dramatic recovery, just gone. And the terrifying truth is that many of these people were considered healthy. Some were athletes. Some were running marathons just weeks before. Their doctors were not worried. Their annual blood work looked fine. And yet, something was happening deep inside their arteries that none of those tests could see. This video is going to change the way you understand your own body, because the heart does not fail the way most people think it does. To understand why a perfectly healthy-seeming heart can fail without warning, you need to understand how the heart feeds itself. Most people know the heart pumps blood to the rest of the body, but fewer people think about the fact that the heart also needs its own dedicated blood supply just to keep beating. Wrapped around the surface of the heart is a network of vessels called the coronary arteries. Early anatomists thought they looked like a crown sitting on top of the heart, which is exactly where the word coronary comes from. But a better way to picture them is as the root system of a massive, ancient tree. Every branch, every leaf, every ounce of life in that tree depends entirely on those roots staying healthy and open. There are 2 main coronary arteries, the right one and the left one. The left coronary artery quickly splits into a major branch called the left anterior descending artery, or the LAD. In emergency medicine, we have a nickname for this specific vessel that tells you everything you need to know about how serious it is. We call it the Widowmaker. The reason is pure anatomy. The LAD supplies blood to the front and lower portion of the left ventricle, which is the most powerful chamber of your heart, the one responsible for pushing blood out to your entire body. Using the tree analogy, the LAD is not a small twig. It is the main trunk. Block a small twig, and you lose a few leaves. Block the trunk, and the entire tree collapses instantly. Now here is where things get complicated, and where most people have the wrong picture in their head. When people imagine a blocked artery, they imagine something like a clogged kitchen drain. They picture gunk slowly building up on the inner walls, the pipe getting narrower and narrower, the water pressure dropping, until eventually one day the flow just stops completely. They assume they will feel it happening. They expect to get warning signs as things gradually worsen, maybe some chest tightness going upstairs, maybe some unusual fatigue. That image is completely logical. The problem is that it is biologically wrong, and that mistake is costing people their lives every single day. The truth is that arteries are not passive pipes. They are living, intelligent tissue that actively responds to what is happening inside them. When plaque starts to build up inside an artery wall, the artery does not simply get narrower. Instead, it actually expands outward to make room for the growing deposit. Doctors call this positive remodeling, and it is a survival mechanism that your body uses to preserve blood flow for as long as possible. What this means in practice is absolutely chilling. You can have a massive accumulation of plaque inside your artery wall and still have a completely normal opening for blood to flow through. The channel stays open, the blood keeps moving, and you feel absolutely nothing. This is why you can run a 10-kilometer race, cross the finish line, feel fantastic, and still have a 90% blockage developing inside your coronary arteries. Your body is so remarkably good at compensating and adapting that it can mask these problems right up until the moment of catastrophic failure. There are no gradual warning signs in many cases because the blood supply stays intact through the process of positive remodeling. The first sign that something was wrong might also be the last sign you ever get. This is not a rare scenario. This is how the majority of heart attacks actually happen. Not with a slow fade, but with a sudden, devastating switch being flipped. To understand how that switch gets flipped, you need to know how the plaque actually forms in the first place. A healthy artery on the inside is incredibly smooth. The inner lining, called the tunica intima, is almost frictionless when it is working properly. Blood cells glide through it the way a hockey puck glides across fresh ice. But over the years, various forces begin to damage this lining. High blood pressure creates mechanical stress that physically tears at the vessel wall. Chronically elevated blood sugar causes widespread inflammation that weakens the tissue. Smoking introduces toxins that corrode the inner lining directly. Even the years of high-volume blood flow, from decades of intense endurance exercise, can cause repeated microscopic damage to these delicate walls. Once those tiny tears and scratches appear, your body tries to repair them. It sends LDL cholesterol particles to the site, like spackle, being used to patch a crack in a wall. Then your immune system dispatches white blood cells to inspect the repair job. These white blood cells start consuming the cholesterol at the damaged site, and over time they transform into what scientists call foam cells. These foam cells accumulate, harden, and combine with calcium and cellular debris to form what we know as plaque. The medical term for this entire process is atherosclerosis. And while your body does all of this with the best intentions, the end result is a dangerous, potentially unstable deposit buried inside the wall of an artery your heart depends on to stay alive. Here is the detail that separates the people who survive from the ones who do not. Not all plaque is created equal. Some plaque is old, hardened, and calcified. It has been there for years. It is dense and rigid, and while it is not ideal to have it, it is relatively stable. The truly dangerous plaque is the soft kind. Soft plaque is filled with inflammatory material and covered by nothing more than a thin, fragile cap of tissue, like a blister, just under the surface of the skin. This type of plaque does not necessarily block much blood flow at all. In fact, a soft plaque causing only a 40 or 50% narrowing is dramatically more dangerous than a hardened plaque causing a 70% narrowing, because the soft one is ready to explode. When a sudden spike in blood pressure hits, or when extreme physical exertion sends a surge through the arteries, that thin cap over the soft plaque can tear open. This is called a plaque rupture. And what happens next is where the real tragedy unfolds. When the plaque ruptures, its contents spill directly into the bloodstream. Your body immediately recognizes this as a catastrophic wound and responds by sending platelets rushing to the site to form a clot. If this happened on your skin after a cut, you would call it miraculous. Inside a coronary artery, it is a death sentence. Within minutes, the clot grows so large that it completely seals off the artery. Not the slow buildup of plaque, but the sudden explosive formation of that clot is what stops the heart. It acts like a cork jammed into a bottle. Blood flow ends. The tissue beyond the blockage begins to die. But there is a second type of heart attack that does not get nearly enough attention, and it is particularly relevant for people who consider themselves active and fit. Imagine a disciplined 50-year-old runner, someone who has been training for years, watches what he eats, and takes his health seriously. During a race, he does not feel crushing chest pain. He just feels off. His energy drops suddenly. He feels lightheaded and queasy. He assumes it is dehydration or the heat and keeps pushing. At the hospital, doctors run a blood test and find elevated levels of a protein called troponin. Think of troponin as the liquid inside a glow stick. As long as the casing is intact, nothing leaks. But snap the stick, and the liquid flows freely. Heart muscle cells are packed with troponin. When those cells die, they break open and release troponin into the bloodstream. This man is having a heart attack. But when doctors look at his arteries, they find them only 50% blocked. This is not a mystery. It is a supply and demand crisis. Sitting on a couch, a 50% blockage barely matters. The artery is crimped, but enough blood still gets through to keep things running smoothly. But the moment that man's heart rate climbs to 170 beats per minute during a race, his heart muscle demands an enormous surge of oxygen-rich blood. The partly blocked artery simply cannot keep up. The demand for blood massively exceeds the supply, and the heart muscle begins to suffocate. This oxygen starvation is called ischemia. It can cause permanent damage even without a complete blockage, and it is far more common in active people than most cardiologists discuss openly. The situation can get even more dangerous when a condition called atrial fibrillation enters. The picture. Your heart runs on a precise electrical system that coordinates every beat in a smooth, rhythmic squeeze. In atrial fibrillation, the upper chambers of the heart stop beating properly and begin quivering chaotically, like a bag of worms. This electrical chaos throws off the timing of the entire heart. The heart beats too fast, too irregularly, and it loses efficiency. When you combine atrial fibrillation with even a moderate arterial blockage during intense exercise, you create a perfect storm. The heart beats so rapidly it cannot fill properly between beats. The arteries cannot deliver enough oxygen to keep up with the pace, and the heart muscle, caught between these two crushing forces, begins to break down. There is also a threshold most people have never heard of that changes everything about how you interpret your own sense of physical wellness. Generally speaking, you will not experience chest pain or significant symptoms until an artery is narrowed by roughly 70% or more. Below that threshold, your heart simply compensates. It adapts. It finds a way to keep functioning without sending you any clear distress signals. This is what makes the common logic of feeling fine, therefore being fine, so extraordinarily dangerous. The majority of heart attacks, occur in arteries that were less than 50% blocked at the time of the event. Not because those arteries were the most clogged, but because the soft, unstable plaques sitting inside them were the most likely to rupture without warning. Your heart does have one remarkable built-in defense system worth understanding. It is called collateral circulation. When a partial blockage has been present for many years, the heart slowly begins to grow tiny new blood vessels that route around the obstruction, like a GPS finding alternate roads around a highway closure. This is why older people sometimes survive heart attacks that kill younger people outright. A 70-year-old whose artery has been narrowing gradually for 2 decades may have built an entire secondary network of detour vessels around the problem area. When the main road closes, the side roads are already there. A 40-year-old whose plaque ruptures suddenly has no such network. The highway closes, and there is nowhere else to go. The good news is that you can actively encourage your heart to build this collateral network, and the tool for doing it is exercise. Specifically, a combination of Zone 2 cardio, the kind of steady, conversational pace effort that keeps your heart rate moderate for extended periods, and high-intensity interval training, which challenges the heart in short, powerful bursts. These two training styles together force your coronary vessels to expand, multiply, and strengthen over time. You are literally building your own bypass system with every workout. Exercise does not just make your heart stronger, it builds the emergency infrastructure that could one day be the only thing standing between you and a fatal event. If the worst does happen, speed is the only thing that matters. In emergency medicine, we use a phrase that every person alive should know. Time is muscle. From the moment blood flow stops, the countdown begins. Within 20 minutes of a complete blockage, irreversible damage to heart tissue starts occurring. By 90 minutes, that tissue is not just damaged, it is dead, permanently replaced by scar tissue that will never beat again. Scar tissue does not pump. Every percentage of heart function that scars over is gone forever. This is why recognizing symptoms and calling for help immediately is not an overreaction. It is the most rational thing a human being can do. And the symptoms are not always what Hollywood has taught you to expect. Men tend to experience the classic version, a crushing pressure in the chest that radiates down the left arm. But women are far more likely to experience something completely different. Profound and sudden fatigue that feels unlike normal tiredness. Unexplained shortness of breath without exertion. Nausea that seems to come from nowhere. Jaw pain. Upper back discomfort. Symptoms that are easy to dismiss as stress or indigestion. Perhaps the most underrated warning sign of all, cutting across both men and women, is a sudden, inexplicable sense of doom. A feeling that something is terribly wrong, that cannot be explained. Do not talk yourself out of it. That signal from your body deserves immediate attention. The most important thing you can take from everything you have just learned is this. Standard blood tests are not enough. Checking your cholesterol tells doctors what is in your blood. It tells them absolutely nothing about whether plaque is already accumulating inside your arterial walls right now. There are two scans that give you the actual information that matters. The first is a coronary artery calcium score, or CAC scan. It is a quick, low-radiation scan that looks for hardened calcium deposits in your coronary arteries. A score of 0 means no calcified plaque is present. A score above 400 puts you in a high-risk category that demands immediate medical attention. The second is a CT angiogram, which goes even further by making soft plaque visible, the unstable, uncalcified deposits that a CAC scan misses entirely. This is the early warning system that can show you the danger before it becomes a disaster. The heart attack that strikes a person who considered themselves perfectly healthy is almost never truly random. It is almost always the result of a process that has been building silently for years or even decades, invisible to standard testing, unfelt by the person carrying it, and completely preventable with the right information at the right time. Control your blood pressure, because mechanical stress is what starts tearing the arterial walls in the first place. Manage your blood sugar, because chronic inflammation is what turns small damage into dangerous plaque. Keep exercising intelligently, because movement is what builds the collateral network your heart may one day need to survive. And most importantly, do not rely on how you feel as your primary health metric. Get the scans, get the data, know what is actually happening inside your arteries. Feeling fine is not the same as being fine. And in the case of your heart, that difference is everything.